Hello, my name is Jenna Brennan. Today I'll be taking us through an exercise plan for my patient Emma. Emma is 21 years old and she is a former gymnast. She did gymnastics from ages 4 to 18. She also participated in soccer from ages 4 to 6, dance ages 4 to 11, cheerleading ages 7 to 17, and track from ages 12 to 18. Next, I will be going into our needs analysis. For the needs analysis, we're going to break it down into 4 components, being the physiology, biomechanic, medical, and desired outcomes. For the physiology, we're going to just be determining the energy pathways and then the need of activity based on what fitness components are being used and also the intensity of the activities. For the biomechanical aspects, we are going to be looking at the muscles and joints being used. For medical, we are going to be diving into my patient's medical history, previous injuries, just so we can give exercise to prevent these injuries from reoccurring, and also look into other injuries that might be common in what my patient is participating in. And then finally, for the needs analysis, we are going to be going over my patient's goals that they're desiring from this exercise plan, as well as what their training status is currently. With my patient Emma being a former gymnast, her energy pathway is mostly aerobic. Most of the movements in gymnastics are high and fast bursts of energy. In gymnastics, there's several fitness components that could be very beneficial. These can include strength, power, speed, balance, agility, flexibility, and endurance. Gymnastics is considered a high-intensity exercise. For the biomechanical analysis, several muscles are used in gymnastics. This includes your arms, your legs, your shoulders, your back, your core, and this is due just to all the different movements that gymnasts are required to make, like flips and running and vault. That goes hand in hand with joints. All the joints are very important for gymnastics. And this sport requires a very large range of motion. Your resistance pattern comes from your own body weight, and your velocity would vary from quick sprints and vault, spins, and flips. Okay, now we're going to dive into my patient Emma's medical history. In 2014 to 2016, Emma was suffering with Osgood-Schlatters disease, which was causing her great pain in her legs. She also has suffered many severe ankle sprains in gymnastics. She has torn both of her Achilles, her first Achilles torn in October of 2019, leaving her ends of her Achilles shredded. Then she also tore her right Achilles in March of 2021. With Emma's injury history, I would recommend several exercises to reduce this injury from reoccurring. I would recommend balance exercises, stability, mobility, strengthening, and flexibility exercises. Common injuries in gymnastics can include shoulder injuries, knee injuries, ankle injuries, ACL tears, Achilles strains, and wrist sprains. So now we're going to get into the goals and training status of my patient Emma. Emma has goals to build back muscle, lean out, increase endurance, strengthen her Achilles to decrease pain and soreness, and also reduce the risk of injuring her Achilles again. In the past, Emma utilized stretching and dynamics on the floor, aerobic exercises of high intensity, sprints, high knees, weightlifting, and tumbling. Currently, Emma goes to the gym 5 days a week. She begins with stretching and light mat conditioning. She loves to start her workout with the Stairmaster for 10 to 15 minutes. She does squats, deadlifts, and utilizes machines for her arms. Bulgarian squats, leg press, stretches out her calves, and finishes on the treadmill with a inclined run or walk. After going through all of my patients' background and needs analysis, I will now be assigning exercise assessments. These will include post-test, mid-test, and pre-testing through the exercise program just to track the progress of my patient. The test is administered in a particular order, this being body comp, muscular strength, endurance/power, cardiovascular, and ending with flexibility. For exercise assessments, I will be assigning my patient Emma to do the Blake protocol, Queen step test, 1RM deadlift, ankle mobility, and stand and reach test. In the next few minutes of the video, I will be guiding my patient through these exercises. Before I get into the demonstrations for the exercises, I wanted to take a moment to explain why I chose these exercise assessments for my patients and how this is going to help me prescribe exercises to my patient after we complete the assessment. So the first exercise assessment that I will be putting Emma through is the bulky protocol. This is a treadmill protocol, and it's also known as the VO2 max test. This is a fitness test that looks into the athlete's cardiovascular condition as well as endurance by taking the VO2 max from the end result of the assignment. I feel like this will be a perfect pre-assessment to put my patient through so we can figure out where her endurance is and what exercise we should include and prescribe to increase this endurance and just see where the growth goes with it. One of her goals is to find this increase of endurance, so I feel like this is a good baseline assessment to see where my patient is and kind of get a grab for what I should prescribe to her. The next exercise assessment that I will be conducting in my exercise plan for my patient Emma is the Queen Step Up protocol. This also looks into the VO2 max. However, prior to the exercise, we are going to be taking my patient's heart rate. Then we're going to be taking her heart rate post-exercise to see how quickly her heart rate returns back to like the normal resting rate. And if you have a very quick recovery, that means that you are more aerobically fit. So I feel like this would be a very good assessment for my patient. The next exercise assessment that I will be conducting with my patient is the 1RM. This is 1 rep of your maximum weight. This can either be through bench press, squat, or deadlift. For my patient, we will be doing deadlift. This is just determining my patient's maximum strength and just seeing where she is, because one of her goals is to increase her strength and find more leanness in her body. So I feel like this gives me a very good level to prescribe different exercises to increase strength in some areas that she's looking to increase. Also, this test is used for determining winners in powerlifting and weightlifting competition. The next exercise assessment that I am going to be conducting with my patient is ankle mobility. For my patient in particular, she has had a lot of previous ankle problems, so I wanted to kind of get a baseline of where her ankle mobility is, and after determining this, I can then prescribe exercises that I feel can help increase the strength in her ankles, her Achilles, and just give me a baseline of what this range of motion is looking like. The final assessment that I will be conducting with my patient is the standard reach. This is kind of just giving me the baseline of her flexibility since she is looking to increase flexibility. So this gives me a good measure of where she is and what exercises I can prescribe to help increase this flexibility that she has.
Okay. For this exercise assessment, I have my patient doing the bulky protocol. We're starting with a speed of 3 miles per hour, and we're at a grade of 0. And every 3 minutes, we're going to increase the grade by 2.5% until my patient reaches fatigue. For the next exercise assessment, we're going to be doing the Queen Step Up test. We're going to start by finding my patient Emma's resting heart rate. So now my patient is performing the test with a metronome of 88 beats per minute in the formation of up, up, down, down. My patient will be doing this for 3 minutes, and then we're going to measure their heart rate. The next exercise assessment that I'll have my patient do is a 1RM. We have chosen to do the deadlift. The protocol for this assessment is 1 set up from 5 to 10 reps for 40 to 60% of your estimated 1RM. And then we are going to take a 1 to 3 minute break. Then we're going to do 1 set of 3 to 5 of your 60 to 80% estimated 1RM, and then you're going to rest for 3 to 5 minutes. And then after the warm-ups are completed, you are going to attempt your 1RM lift, which is your maximal weight. Go. So next we are doing ankle mobility, and my patient has her foot lined up with the wall. Now we're going to see how close her knee can touch to the wall without lifting up her ankle before we do the ankle mobility exercises. So go ahead and try to. After the ankle mobility, we are going to come back and see how much closer her knee is to the wall. We first have her in this position, just kind of rolling the ankles for about 45 seconds, and then switching to the other ankle. Then next we have her spinning her ankle, and we're going to do this for 45 seconds and then switch to the next ankle. Okay. The next exercise we're doing is bringing the foot in, bringing it out. I'm going to do this one for 45 seconds. Then we're going to flex the foot up and down, again for about 45 seconds. Then we're going to do this exercise where you're lifting your foot up and then putting it down and alternating between the feet. We're also going to do this for about 45 seconds. And then we have her in a squat position, bringing her foot in and out, just getting that ankle moving. We're going to have her do that for about 45 seconds. For our next exercise assessment, we're going to be doing the stand and reach. The equipment for this will be the box and the ruler. So I'm going to have you go ahead and stand with your shoes off on the box with your feet slightly spread apart. Okay, and then keep your legs straight on the edge of the box. And then before you lean down, make sure that you are breathing in and then breathe out during the reach and go down as far as possible and do not bounce. This should be like one smooth moment for you. Hold the position for 2 seconds and then we will measure that. So go ahead and breathe in, 2, and then we would measure down there from the steps to the fingertips.
Now that we're done with the exercise components and assessments, I will be prescribing my patient specific exercises. These will include calf raises, lunges, pike stretches, Achilles stretches, ankle alphabets, dumbbell rows, rowing, push-ups, and sprints. Between the exercises, I will be explaining why I prescribe these exercises to my patient and what benefits they have to her. Starting with calf raises are very good for ankle mobility, balance, and flexibility, which is very important for my patient who suffered through ankle sprains and Achilles tears. And this can also help reduce injuries to the ankles. The exercise I will be prescribing is calf raises. We're just going to go onto your tippy toes and come back down. And we're going to do this for 3 sets in 10. The next exercise I prescribed was lunges. Lunges can help with hip flexibility, improve balance, weight loss, core stability, strong glutes, and just improve stability in general. I feel like these would target a lot of Emma's goals for this exercise program. I will be prescribing for my patient is going to be lunges. We're going to do 5 back and forth, so a total of 10, 3 times. The next exercise I'm prescribing for my patient is pike stretching. This improves flexibility, balance, coordination, improvements of posture, and improvements of upper body flexibility as well. I feel like this would be very good for Emma's increase of flexibility that she's looking for. The exercise I'm prescribing to my patient is a pike stretch. So you're going to keep your legs together and you're going to reach out and touch your toes. And I'm going to have you hold this for 10 seconds and we're going to do this 3 times. The The next exercise I prescribed was Achilles stretching. I find this one to be very beneficial for Emma. It helps reduce injury, decrease muscle fatigue, it helps with range of motion, faster recovery from injury or exercise. It lubricates your joints and connective tissue, and it can decrease pain, which is one of the goals that she was looking for.
The exercise I'll be prescribing to my patient is an Achilles stretch. So you're just going to line yourself up with a wall and then put one foot up. And I'm going to have you do that 10 times for 3 sets. I'll also be having my patient alternate their feet for this exercise.
The next exercise I prescribed was ankle alphabet. This can help loosen up your muscles and tendons. It can improve your range of motion, and it reduces pain and stiffness, which is another goal that Emma has for her ankle and like Achilles area.
This next exercise, I'm going to be having my patient do a ankle alphabet. So you're going to take your foot and with your heel and your toes, just spell out the different letters of the alphabet, A to Z. And we're going to do it in a slow motion just to make sure to get that.
The next exercise I prescribed was dumbbell rowing. This is a strengthening exercise. It has a lot of benefits for the upper extremity muscles. So I thought this would be a good exercise to incorporate.
For one of the exercises I'm going to be prescribing to my patient will be dumbbell rows. We're going to do 3 sets of 10 reps. So for the dumbbell row, you do just like this. And then you have to move to the other side.
That's a great question. I don't know. Mark my group. So I might be busy. I'm trying to see my brother.
The next exercise I prescribed was rowing. I felt like this is a very good exercise to include aerobic exercising. It can improve your cardiovascular health. It's low impact, putting little stress on your knees and your ankle joints, which I feel is important for Emma. It's also a full body workout, and it helps improve flexibility as well.
The exercise I'm going to be prescribing to my patient is rowing. We are going to be doing 30 seconds of rowing and then 10-second rest, and we're going to do this 4 times. So you're going to reach forward. Ready?
The next exercise I prescribed was push-ups. Emma said that she was looking to get lean and also gain back strength, and this is a good exercise for upper body strength, for your chest, shoulders, arms, back, stomach, and hips.
The next exercise that we will be doing is push-ups. We are going to be doing 5 push-ups for 3 sets to start.
The next exercise I have prescribed to Emma is short sprints. This is very good for cardiovascular health, bettering your body composition, and increasing your metabolism.
Guys, I'm going to be prescribing. I'm going to have my patient start at this pole right here and then run through that hallway 4 times.
Good. So this is the end of my exercise plan for my patient. Again, going through just everything that we went through today. We started with exercise assessments being the bulky protocol, Queen step, 1RM, ankle mobility, standing reach, and then we ended with our exercises being the calf raises, lunges, pike stretches, Achilles stretches, ankle alphabet, dumbbell rows, rowing, push-ups, and sprints. After going through all of my patients' background and needs analysis, I do feel like these will be the best exercise components to bring to my patient, and I hope that she has a positive experience with the things I have assigned and prescribed to her. Thank you for watching.